Hello, and welcome back to class. Today we are going to talk about Chapter 7. Chapter 7 I have split into two separate sections because it's a lot of information. We are looking at the skeleton. So the first part of the skeleton we will look at is the axial skeleton. If you remember from Chapter 6, that axial skeleton is your skull, your spine, your rib cage. So let's get started here. Last chapter, we looked at how bone is made. Now we're going to look at the names and parts of all the different bones. So the skeletal system, or the skeleton, as we've talked about, it's bone. But we also have, as part of the skeleton, cartilage, because remember, cartilage is on the ends of all of our long bones. And our short bones, any joint that moves has cartilage. Speaking of joints, ligaments. Sometimes we use ligaments to hold one bone to the next bone. That whole system is mostly skeleton, but it is made of some other parts like ligaments. Your skeleton only accounts for 20% of your mass. It's not a lot, comparatively. So, as I said, we're talking about the axial skeleton today in this PowerPoint, in this lecture. We're also going to talk about the appendicular skeleton in the next PowerPoint. So as I said on the first slide, that axial skeleton is your skull, your vertebral column, and your thoracic cage. That's about 80 bones. The good thing is majority of the bones in your spine all have the same parts to them that you need to know. So that really helps. You don't need to know 80 different bones. A lot of them are pretty similar. So your axial skeleton, that gives you that longitudinal access to your body, that height, your trunk, your head, your neck. It protects your brain, your spinal cord, and your thoracic organs, your heart, your lungs. They're all protected. So everything in blue, like a bluish green in this picture, is your axial skeleton. This is what we're going to look at in this lecture. Here's the backside view. Everything in that like bluish green color is our axial skeleton. So we're going to start with the skull. There's a lot of bones in the skull and a lot of parts to bones in the skull. The skull is probably the most complicated bone with features and parts in the entire body. So as I just said, it's the most complex bony structure in the body. It really is. It houses your brain. Nerves come out of it. Blood vessels go in and out. It has your eyes, your mouth, your ears, your nose. It's got to house all of that. But it also provides attachment sites for muscles for your head and your neck. Those are also important. Those are kind of help, well, they'll let your head move around. So let's start with our face. How your face looks is determined by the bones in your face. And I've also said it houses your special sense organs, like your sight, taste, smell. It has openings for air, food, even openings in your ear. Your teeth are secured in your facial bones. Your facial bones also have your muscles of facial expression. We'll go into those when we get to the muscle chapter, but there's muscles specifically attached to the bones in your face that let you smile, let you squint your eyes, let you look angry or stressed or confused, all of it. So most of the bones in your face and your skull are flat. Especially in your skull, they're locked together. Your mandible, which is the lower part of your jaw, is the only movable point in the body. So there are joints that make up the different bones that make up your skull. They are called sutures. And they're kind of like a serrate, like a sawtooth appearance. So here's some of the different sutures. As you can see, it's a pretty jaggedy line here. And these bones eventually sutured themselves together. These used to be separate bones with cartilage in between when you were a baby. But they grow and they suture together. So the bones at the top part are what make up your cranium, while the rest of them are facial bones. So your facial bones, of course, they have to be on the anterior aspect because that's where your face is. The cranium is the rest of it in the back. There's two parts. There's a vault to your cranium and a base to your cranium. That's kind of the inside part. The vault is a superior, lateral, and posterior. It includes your forehead. That base, it's got some steps in there. When we look at the inside of the skull, we'll kind of see it. But there's an anterior, a middle, and a posterior fossa is what they are called. The brain sits within these fossa. And then these cranium, or those cranial bones, enclose it to keep it safe. So here is our anterior cranial fossa. It's this part up in the front. Our middle fossa is the part here in the middle. Our posterior fossa is this whole area through here. So as you can see, that anterior fossa up in here, part of your brain fits. That middle fossa in here. And that posterior fossa through here. All houses parts of your brain. Very important. They protect your brain very well. So we have a middle ear and an interior ear cavity in our skull, or our cranium. We have a nasal cavity, and we have what are called orbits, where your eyes sit. We have 85 different openings in the skull. That's why I said the skull is the most complex bones. There's so many different openings for so many different things. They have the name foramina, canals, or fissures, depending on their shape. It's where the spinal cord comes out of the skull. Blood vessels go in and out. We also have cranial nerves. When we get to the nervous system, we'll go into a lot more detail about what those do. but there's 12 cranial nerves that come out through some of these openings in the skull. So here's the different cavities. We have our cranial cavity at the top. Here's our orbits. Here's our oral cavity. It's kind of a slice through the front of the face here. So our cranium is technically made up of 8 bones. Some of them are paired, and some of them there's only one. We have our frontal bone. That's where your forehead is. Your parietal bones, you have 2. Those are on the sides, right behind that frontal bone. You have an occipital bone. That is in the back of your head. Temporal bones, those are down closer to your ears. The sphenoid bone and the ethmoid bone are inside of the cranium. So let's talk about each of those bones. The frontal bone. That frontal bone is kind of a shell shape, and it forms that anterior part of the cranium. There's different parts to the frontal bone. We have a squamous region. That's your forehead. We have on the bottom part of the frontal bone, we have supraorbital margins. That's just underneath your eyebrows. The frontal bone actually makes a superior part of your orbit. In most of the anterior cranial fossa, we have a supraorbital foramen or notch. That's just above the eyes, kind of a little bit just above the eyebrows too. But that allows the supraorbital artery and nerve to pass to the forehead. Very important. We have what is called a glabella. That is the area between the orbits. We also have the frontal sinuses. Those are just above your eyebrows kind of too, just lateral to that glabella. So let's look at our frontal bone. We see that glabella here. We follow it. Our glabella is this area right here. We have our supraorbital foramen. Like I said, they're kind of right in here. You don't see it in this picture, but there is frontal sinuses kind of up in this area a little bit. We have that supraorbital margin. So it makes up the superior part of our orbit. As I said, we have 2 parietal bones. They sit just behind the frontal bone. They have 4 different sutures. Coronal suture. That is between the parietal bones and the frontal bone. If you remember, that coronal plane cuts you into a front and a back. So if that kind of helps you picture where that coronal suture is, that's what it is named for. A sagittal suture. That is between the right and left parietal bones. That's on the inferior part of that parietal bone. The lambdoid suture, that's between the parietal and the occipital bones. You know what a lambdoid Greek letter looks like? It's kind of what that suture is kind of looks like. That's why it's named that. We also have a squamous suture between the parietal and the temporal bone. So let's look. That coronal suture. As I said, it's kind of like that coronal plane. We have that squamous suture. We have that rhomboid suture. And this is our parietal bone. This is our frontal bone. Temporal bone. Occipital bone in the back. So here is everything with the names that I just wrote out. Parietal bone with that coronal suture. Frontal bone. Squamous suture. Rhomboid suture. I think I got them all. And here it is on a real human skull. You see that coronal suture. You see that parietal bone, that frontal bone, that squamous suture, that rhomboid suture. Oh, that occipital bone in the back. Here it is from the inside. Different views seeing the same thing. Squamous suture. That parietal bone, coronal suture, frontal bone. Same thing on a human skull. Let's look at the occipital bone. It's that posterior part of your skull. You feel the back of your head. You can feel some different bumps back there. Those different bumps are actually on your occipital bone. But that occipital bone actually articulates with the parietal, temporal, and sphenoid bones. It has the largest hole in the skull, really. Foramen magnum. Magnum means large hole in foramen. Because that's where your spinal cord comes out of and goes down to send nerves out to the rest of the body. On the bottom, it has what is called an occipital condyles. That's what actually articulates with the first vertebrae of your spine. It contains a hypoglossal canal. That's where cranial nerve 12 comes through. External occipital protuberance. That's usually the big bump that you can feel in the back of your skull. Females, if you ever try to wear headbands, if you have a big enough occipital protuberance, it holds those headbands in place. But if you do not, that's why your headbands do not stay in place, is because that external occipital protuberance is not big enough. We have an external occipital crest. There's a ligament that's in the cervical spine only. It's called the ligamentum nuchae. That's where that ligamentum nuchae actually attaches, is on that external occipital protuberance. We also have superior and inferior nuchal lines where muscles for the neck, even all the way down into the back, attach. Like I said, every place that a muscle attaches has a name. So here is our occipital bone. We have our superior nuchal line, our inferior nuchal line, our occipital condyles on the bottom, our external occipital protuberance with our external occipital crest. You can feel most of this if you feel around the back of your skull. Here is an underside so we can see those occipital condyles much better. Also the foramen magnum, this is where your spinal cord comes out. These condyles is where your skull actually attaches to the first vertebrae of your entire spine. And here it is on a human skull. Those occipital condyles, that foramen magnum. We have our superior nuchal line we can see pretty well with a really nice occipital protuberance back here. Temporal bones. We have two. Nice thing is once you learn the names of the bones of the cranium, it'll help you learn the names of the lobes of the brain because they match. Keep that in mind. So our temporal bones. They're kind of on that, they're below the parietal bone. So it's closer to kind of where your ear or towards the front of your ear, where your cheek kind of makes up part of that cheekbone. That zygomatic process actually makes up your cheekbone. Part of that zygomatic arch, and it also has a mandibular fossa. That's where the mandible, the movable part of your jaw, the bottom part, attaches. Your temporomandibular joint is there. So if you've ever heard of TMJ, that is what they're referring to. It has something to do with that joint. We also have the tympanic, or the external acoustic meatus, which is that external ear canal. Like I said, it was part of the ear, the front of the ear, the cheek. That all comes from your temporal bones. We have a petrous, which houses the middle and internal ear cavities. It's part of the middle cranial fossa. We have our jugular foramen, where 3 cranial nerves exit the skull. Carotid canal for that internal carotid artery. Foramen lacerum, kind of a jagged opening, but it's covered by cartilage when you're alive. When you're not alive, after you die, it's more of a foramen at that point. Your internal acoustic meatus and your stylomastoid foramen, more cranial nerves. You have your mastoid process and your styloid process. That's where muscles attach. So this orange, the lighter orange, is your temporal bone. So you can see we have our zygomatic process. That makes up part of that cheekbone. We have that mastoid process. We have that styloid process. The styloid is more of a short point. The mastoid is bigger. We have the condylar process. So we have that condylar notch up here where the condyle of the mandible will attach. So here it is in a human skull. Again, we have our zygomatic process. We have our temporal bone, this whole bone here. We have our mastoid process, our styloid process, all part of that temporal bone. Here's another shot of just the temporal bone. We do have these bones in the lab. Have just the temporal bone. So if you see that, no, this specifically is that temporal bone. Because here you can see that external acoustic meatus. That is that outer ear. We have that mastoid process, styloid process, mandibular fossa, zygomatic process, tympanic part, all part of the ear. Here's an underside. You can still see that temporal bone with the zygomatic process. You see that styloid process over here, this mastoid process behind it. Here you see the stylomastoid foramen, external acoustic meatus. You see that carotid canal. You see part of that foramen lacerum. Foramen spinosum. Those were all talked about. We even have our jugular foramen. So all those are all the foramens we had spoken about before. You can see them from the underside. You can also see them inside the skull. So let's look at this. Now we're looking from the inside. So this orange bone is still the temporal bone. We have that jugular foramen, internal acoustic meatus, part of that foramen lacerum, foramen spinosum. And we either have many other foramens as well. Here it is in a human skull. Foramen lacerum, foramen spinosum, jugular foramen, all part of the temporal bone. So that mastoid process is actually kind of like spongy bone, but in a way it's not because it has more air cells in it. So they're called mastoid air cells or sinuses. Those sinuses are what kind of helps make the skull lighter. But those mastoid air cells can get infected. And that can be called mastoiditis. Anytime you see the itis in a word, that means inflammation. So somebody may have a middle ear infection and it can spread to that mastoid process. Since those mastoid air cells are so close to the brain, this can actually lead to an infection in the brain. Not good. Another bone in our cranium is called the sphenoid bone. The sphenoid bone is said to look like a bat. Kind of does. But it has the sphenoidal sinuses in the sphenoid bone. We have what is called the sella turcica. The sella turcica actually holds pretty important part of the brain. It holds some of the glands in the brain. We have an epiphyseal fossa, and that is where the pituitary gland sits. So, our sphenoid bone has greater wings, lesser wings, and a pterygoid process. That sphenoid bone makes up part of the optic canal. It's where the optic nerve comes in. The superior orbital fissure, that's where that is a cranial nerve passage. We have the foramen rotundum and the foramen ovale, and it's part of the foramen spinosum. We do have this bone in the lab as well. This, looking at it from this angle right here, it does kind of look like a bat. But as you see, we have our greater wings. They're the big ones. The lesser wings, they're the smaller ones. We have our sella turcica right in here. Your pituitary gland sits there. Here's your lesser wings from this angle, your greater wings from this angle. Your optic canal, your pterygoid processes. That's where the pterygoid muscles of your mouth attach. Sometimes the processes are named for what attaches to them. Sometimes they match. It's kind of nice. Let's look at the ethmoid bone. This is the deepest bone in the skull. So it helps to form this cribriform plate. That makes up the roof of your nasal cavity, and that's where your nerve, your otic nerve for your nose, has little finger-like projections that goes through that cribriform plate and goes into your nasal cavity. We have what is called the crista galli. That's kind of where your brain's dura mater attaches. Dura mater, when we get to the nervous system, we'll see it helps to protect your brain. We have a perpendicular plate. Perpendicular means it goes so straight down, perpendicular to the rest of the area, named for what it does. That makes up part of your nasal septum. We have lateral masses. They're kind of on each side. They're called ethmoid air cells within that sinus. Those lateral masses form superior and middle nasal concha. We have orbital plates that contribute to the medial walls of the orbit. We also have this bone in the lab, just this. And it comes from right here. So we mentioned that crista galli, that perpendicular plate. We have our middle nasal concha. We have our orbital plate because that makes up part of our eye. We have the cribriform plate, the lateral mass. We have the ethmoid air cells. All very important parts that play a part in our skull. So from this angle, here's the ethmoid bone. You can see that crista galli that sticks up in the middle, then that cribriform plate that has all those little holes in it. Those are the cribriform foramina. Those are where the nerves project down into the nasal cavity. Our cranium also has what are called suture bones. They are just tiny, irregular shaped bones that are kind of made because of the sutures. There's no significance to them. You just kind of see them here and there. Like here's a couple suture bones found in the back. There's nothing really significant to them. They're just kind of there. Help make up that suture between the two different bones. So if you're looking at a skull and you see some of that, that's just what they are. So let's look at the facial bones, the bones that actually make up your face. We have 14 bones total. 12 of them are paired. The only ones that are single are that mandible. That's your lower half of your jaw. Your vomer, that's part of your nose. We have 2 maxillary bones, 2 zygomatic bones, 2 nasal bones, 2 lacrimal bones, 2 palatine bones, and 2 inferior nasal concha bones. The mandible is actually the largest and strongest bone in the face. That lower part of your jawbone makes up your chin. There's an angle that goes, the mandibular angle that goes from, it's kind of that corner, that back corner. If you're feeling along your jaw where the bottom part where it kind of curves up, that's the mandibular angle goes there. We have a superior, we have a coronoid process, which is the top of that rami. And that's kind of where the temporalis muscle will attach. We have a condylar process. We kind of looked at that with the temporomandibular joint before. We have a mandibular notch that separates the coronoid process and the condylar process. We have a body, which has an alveolar process where our teeth are attached. A mandibular symphysis ridge. We have foramina, which are part of the mandibular and mental foramina. So here's everything. Let's look. Here's that condylar process. We have that coronoid process. We have the ramus all along here. That mandibular angle where I said it was that corner. The body, we have that mental foramen in your chin. The alveolar processes are where your teeth attach. The mandibular foramen, mandibular notch, and that's what makes up your temporal mandibular joint, right in there. We have our maxillary bones. We have two of them. They kind of make part of your upper jaw and your central facial skeletal part. We have more alveolar processes because that's where our teeth attach. We have an anterior nasal spine, palatine process, frontal process, zygomatic processes, and maxillary sinuses. We have an inferior orbital fissure in those maxillary bones, an infraorbital foramen, an incisive fossa, and canal. So here's our maxillary bone, or maxillary bone. Here's your alveolar processes for your teeth, anterior nasal spine, infraorbital foramen, because here's our eye up here, the orbital surface. We have part of that zygomatic process. We have a frontal process, and this articulates right here with the frontal bone. So here's a front view of the whole thing. Here's our maxilla, or maxillary bone, infraorbital foramen. And that's all that's really pointed out on the maxillary bone here. Here's the underside. We have the palatine process. That makes up part of the hard palate here. You still see that infraorbital foramen. You see that maxillary bone. Zygomatic bones. Two of those again. As I've said before, zygomatic bone is what makes up your cheekbones. It also makes up the lower lateral part of your eye. It'll articulate with the zygomatic process of the temporal bone, frontal bone, and the maxillary bones. So that blue here is that zygomatic bone. Kind of makes up part of that eye over here, and it attaches to that zygomatic process. Nasal bone. The nasal bones make the bridge of your nose. It'll articulate with the frontal, maxillary, and ethmoid bones, and it actually attaches to the cartilage, to the tip of your nose. We also have our lacrimal bones. That makes the medial walls of the orbit. The lacrimal bones will articulate with the frontal, maxillary, and ethmoid bones. We have a lacrimal fossa with a lacrimal sac. And that's where tears drain. Kind of important. So here in blue, darker, it's like a purple, darker purple is your nasal bones. The green up here are your lacrimal bones, and that's where your lacrimal sac is. Here we see that lacrimal bone, that lacrimal fossa. That is where your tears kind of drain out. Your nasal bone makes up the hard part at the top of your nose. We have palatine bones. Kind of an L-shaped. They have a horizontal plate and a perpendicular plate. That horizontal plate will make up part of that hard palate. The perpendicular plate is part of that nasal cavity. We also have a vomer. That forms part of that nasal septum that separates your nasal cavity into a right and a left side. So this lighter blue here, that's your vomer. Here is your palatine bone. It's a horizontal plate because it makes up the back part of the hard palate. We have our inferior nasal concha. These form the lateral walls of your nasal cavity. We have the ethmoid bone forms two pairs. The inferior nasal conch is the largest of the three. So here we see the vomer. You can see the inferior nasal concha. You see the perpendicular plate of that ethmoid bone. You see that middle nasal concha formed by other bones throughout the skull. So let's look at a bone that is not attached to any other bone in the body. Your hyoid bone in your neck. It's kind of anterior to your neck, but it's below the mandible. As I just said, it doesn't articulate with any other bones of the body. It's only held in place with ligaments. It helps to move. It's a movable base for the tongue. We also have many muscles that attach to that hyoid bone. It allows us to swallow. It allows us to talk. It has many jobs. So here is that hyoid bone. Kind of sits the base of or at the top part of your neck. It's got a place of attachment for several muscles in the front of your neck. Your orbits. Your orbits are your eyes. There are several bones, as we've been noticing, as we've been going through the bones of the skull, that make up your eyes. We kind of went through the nose, so let's go through the eyes. So we have the lacrimal glands that make up our eye and that lacrimal fossa. We have muscles. Our eye muscles attach to the orbits. That's important. And as we've gone through these bones, we've seen the frontal bone, the sphenoid, zygomatic, maxilla, palatine, lacrimal, and ethmoid bones all make up the orbit. So here's the bones of the nose. We've looked at all of these. We have our frontal sinus. We have our superior nasal concha. We've talked about that. Our middle nasal concha. We have our inferior nasal concha, our nasal bone, the superior, middle, and inferior meatus, which is the area underneath each of those concha. We have the palatine bone, We have the perpendicular plate. Here's the horizontal plate. We have the maxillary bone. Now we see it. We have the vomer, which is in here, that nasal bone. You can see some of the different sinuses. Let's find that view of the eyes some more. So as we've said, the sphenoid bone, we can see the greater wings of that sphenoid bone that makes up the eye. We have that lacrimal bone we've looked at. We have that ethmoid bone. We have that zygomatic bone that makes up part of the eye. If you look, we have our inferior orbital fissure. We have our optic canal we've talked about, our superior orbital fissure. That supraorbital foramen, or not, that supraorbital margin we've looked at. There's several of these bones all around that make up our eyes. And now we just looked at our nose. So our nose, the top of our nose is made by that cribriform plate in the ethmoid bone. We kind of talked about that. Where the otic, the nerves, cranial nerve 1, I think it is, sends processes down into the nose to help with smell. The lateral walls are the superior and middle concha of the ethmoid bone, the perpendicular plates of the palatine bone, and the inferior nasal concha. The spaces between it, as I pointed out above, are the meatus. Those concha work to increase the turbulence of air. It warms the air and kind of gets things flowing to get out anything that should not be breathed into our system. The bottom of the nose has the palatine and the maxillary bones, the septum. We have a vomer, that perpendicular plate of the ethmoid bone. And it's also have septal cartilage in there. That we looked at up here. So you can see the septal cartilage that separates the two bones. We have the perpendicular plate of the ethmoid bone. We've looked at most of the rest of these. So let's come back and look at our eye some more. So we have that lacrimal bone. We have part of that maxillary bone. We have the orbital plate of the ethmoid bone. The sphenoid body is in here, the greater wings of that sphenoid. We have the frontal bone that takes up the whole top part. We have the orbital surface of the zygomatic bone, the orbital surface of the maxillary bone, that whole zygomatic bone in there. Orbital plate of the frontal bone. A lot going on in there. Here it is in a real bone, a real skull. Kind of cool looking. We do have some real skulls in the lab that we can use to look at as well. So sinuses. We've seen some of these sinuses. We've talked about them with most of the different bones. Sinuses are actually used to lighten the skull, warm and humidify air, and they actually give your voice the tone or the resonance that you hear. How high pitched or how deep it is, that comes from your sinuses. So we have frontal sinuses, sphenoid sinuses, ethmoid sinuses, and maxillary sinuses. So here's all of our sinuses. We have our frontal sinuses are right up at the top. Ethmoid air cells are considered part of our sinuses. We have sphenoidal sinus just below that, and our maxillary sinuses. These all kind of work to lighten our skull. So here's another view from the side to kind of see that those sphenoidal sinuses are further back. Same with those maxillary The ethmoid air cells, so there are lots of little sinuses throughout, while those frontal sinuses are right up in front. Let's move on to our vertebral column. Our vertebral column, of course, is what houses our spinal cord. It allows attachments for the ribs. It allows for attachment for the pelvis. And it also allows for attachment of the scapula and the clavicle that allows our arms to attach to our body, our legs to attach to our hips that attach to our body. So it starts at the base of the skull and it goes all the way down to the pelvis. It can be called the spine or the spinal column. And it's 26 bones long. Each bone is called a vertebrae. We're going to look at the different characteristics between the vertebrae because it's kind of important to know, because different bones have different shapes. So we'll kind of look at them and talk about what makes each one different here. So we have our cervical vertebrae, which match the cervical region if we remember learning the different regions of the spine. We have our cervical, which are 7 vertebrae long. Thoracic is 12. And then we have 5 lumbar vertebrae. A suggestion from your book talks about 7 a.m., 12 p.m., noon, and 5 p.m. meal times to remember how many vertebrae are in each section. We have a sacrum. Our sacrum was separate bones, but they fused together to make one bone. Your sacrum is actually what articulates with your hip bones. We have a coccyx, which is below the sacrum. It's a fused bones together. It's like a terminus of the column, as it tends to be called. We also have different curvatures. We have a cervical and a lumbar curvature. These ones curve more out. Then we have a thoracic and a sacral curvature that curves more in. So here's all the different regions. We have our cervical curvature with 7 vertebrae, our thoracic curvature of 12 vertebrae, the lumbar curvature with 5 vertebrae, the sacral curvature with the coccyx being about 4 vertebrae long. So what helps to hold these vertebrae together? Because there needs to be something so they don't slide out of place somehow. We have a lot of ligaments that go around our entire vertebral column. We also have plenty of muscles that help to attach different places and help not only hold our vertebral column in place, but also let it move pretty freely. So the ligaments that hold our vertebral column in place, we have an anterior and a posterior longitudinal ligament. As their names state, it tells pretty much right where they're at. That anterior longitudinal ligament is in the front of all the vertebrae. The posterior longitudinal ligament is posterior to the bodies of the vertebrae. I'll kind of show what they look like in a second. The job of that anterior and posterior longitudinal ligament is to prevent hyperextension or hyperflexion. Bending too far forward, bending too far back. We have what is called a ligamentum flavum. Flavum is means yellow. So this ligament actually does look pretty yellow. It's kind of cool. But it connects adjacent vertebrae to each other. Then we also have short ligaments that they connect each vertebrae to the one above and below. So let's look at this. Our anterior longitudinal ligament, as I stated, goes along the front of the entire vertebral column. The posterior longitudinal ligament, it follows posterior to the vertebral. These are vertebral bodies here, we're going to go through that in a few minutes. So here's the vertebral bodies that I'm coloring in yellow. These vertebral bodies, the anterior longitudinal ligament goes in front of it, the body. The posterior longitudinal ligament goes behind the vertebral bodies. The ligamentum flavum connects back here. We have interspinous ligaments because we talked about those other ligaments that connect. What I am going to color in red here, these are the spinous processes of each vertebrae. These spinous processes has an interspinous ligament between each one. So here's another view of that anterior longitudinal ligament and that posterior longitudinal ligament. They help to hold the spine in place. We also have intervertebral discs. These discs are kind of this area right here between each vertebrae. And they work as a shock absorber. They have the nucleus pulsus. If you think nucleus, it's more towards the center. So it's more made up here. Then we have the annulus fibrosus on the outside. The annulus fibrosus is where we have that fibrocartilage we've talked about, and it prevents that nucleus propulsus from traveling away from the middle. Oh, we need it to stay where it's at. Because if you've ever heard of a bulge disc before, that is because this nucleus pulposus leaves the center of the intervertebral disc. That's what causes the problem. Just like this picture. A herniated disc right here. This is hitting a nerve. It's hitting a nerve pretty hard. Kind of painful. But we have this, every level we have spinal nerves that come out. So yes, a disc can easily hit a spinal nerve if it herniates out. Here you can see in this MRI, you can actually see the nucleus pulposus of discs. So here you see down here, you see a nice herniated disc. Those are painful. It's hitting the spinal cord. So that is pretty painful. So there's a lot of things that can actually cause a herniated disc. Herniated or prolapsed disc, they have different names depending on how far that nucleus pulposus has actually traveled outside of that annulus fibrosus. So, and it depends on what it's hitting, because sometimes those discs can bulge out, but they don't hit anything. Those anterior and posterior longitudinal ligaments also help to try to prevent that disc from protruding out from the spinal column. That's part of its job as well. But if it does hit a nerve, it says it can cause numbness. It can cause excruciating pain. Technically, your immune system works to actually eat at those intervertebral discs. It does take at least 18 months, closer to 2 years, for your immune system to eat away at it enough that it's not pushing on a nerve anymore. So, I mean, your body can take care of it. That's why sometimes they say to use exercise, massage, heat, painkillers Those are usually always tried first. They try the conservative measures before they do surgical intervention. Because if you can work through it and get rid of some of the pain through strength training, through massage, pain pills, they try to avoid surgery for this because surgery is not always that effective. So it's just something to think about. There's also abnormal curvatures to the spine. We talked about how the spine has different curves, the kyphotic and lordotic curves. But what if those curves are exaggerated? Or what if those curves go sideways? A scoliosis, that is a curve that goes sideways. So in the spine, all of a sudden they have some kind of lateral curve in it. Could go either direction. It's often in that thoracic region, and it can lead to breathing difficulties. There can also be a rotation, not just a lateral curve, but a lateral and a rotation. We have a kyphosis. A kyphotic curve is that thoracic curve we talked about, where it's like a normal curve in the back, and that's the one that you're actually born with. A kyphosis is also known as a hunchback. That's an abnormal, so it's a lot larger than normal. It can happen with people with osteoporosis, tuberculosis, rickets, osteomalacia. The other one is a lordosis. Our lordotic curve, we said, was our cervical spine and our lumbar spine. Those develop after birth, your lordotic curves. That's why they want babies to do tummy time, because that encourages the baby to pick their head up. By the baby doing tummy time and picking their head up actually gives them the curve in their neck. When they start standing, that's what causes the curve in your low back to form. But what if the curve is too big? That's when it's called a lordosis. It can result from obesity, pregnancy, men with pot bellies. They get these exaggerated curves. So here's a really good scoliosis. This person's got a pretty good curve going on there. Well, here's this kyphosis. This lady's got a pretty good humpback going. Well, this one's got a really good way back going here. So these are different examples of some of these curves. So let's look at the structure of the vertebra. All vertebrae, for the most part, have most of the same features. There's a couple differences between the cervical, the thoracic, and the lumbar vertebrae. But in general, they all have somewhat of the same features. They all have a body, except for the first vertebrae below the skull. That one does not, but every other one in the body has a body to it. That's where it takes on weight. We have a vertebral arch. Let's just look at the picture. We have a vertebral body here. This is where the weight is carried. We have that vertebral arch we just talked about is made up of the lamina, which is this posterior part, and the pedicle, which is the anterior side part here. All of our vertebrae have a spinous process that goes down the back, and then they have a transverse process that goes out to the side. I know for a fact this is a thoracic vertebrae because it has costal facets. Costal for ribs. This is where your ribs articulate with the vertebrae. where they attach. So as we just looked, they have a spinous process, two transverse processes. They do also have a superior articular facet. This is what articulates with the vertebrae above it. They also have one on the underside that's called an inferior articular process that articulates with the vertebrae below it. That's how they connect to each other. So let's look at the specific characteristics in the regions. Cervical vertebrae. As we said, there's 7 of them. They are the smallest out of all of the vertebrae in of the spine. The body, being able to determine cervical, thoracic, and lumbar vertebrae is important. So the bodies of the cervical vertebrae are more oval shaped. Except C7, the last vertebrae, they all have a bifid or a split spinous process. So their spinous process kind of comes down like this. They're split. They have a very large, more triangular shaped vertebral foramen. That is where your spinal cord goes through. The transverse foramen, kind of the wings that come off, have a foramen in them for the vertebral artery. C7 is actually known as vertebra prominence. Because if you feel the back of your neck, you can feel C7. It sticks out very far compared to the vertebra around it. That is why it's known as vertebra prominence, because you can feel it better than any of the vertebrae around it. So here's a chart that talks about the different characteristics. We kind of looked at it, so let's look at our cervical here. As we said, those transverse process has a foramen in it, has a transverse foramen. The body, it has that split bifid spinous process. And this all serves different purposes. That transverse foramen allows that vertebral artery to travel up and goes into the skull. That we have that large triangular vertebral foramen where the spinal cord fits through. It's pretty important to have the cervical spine have a bigger place for it, because that is where our spinal cord is going. And in the cervical spine, our spinal cord is the thickest. So let's look at the side. Again, we see that spinous process. You can still see part of that bifid. You see our transverse process, our body. Cervical vertebrae also kind of have this part that goes up on either side. You can't see it well from the superior view, but you see it from the lateral view. That makes cervical vertebrae as well different on top of those transverse foramen. On top of that bifid spinous process. All of that is what makes cervical vertebrae different. So as we look, here is our cervical spine. You can see we're going to go through how C1 or the atlas and C2, the axis, are different. The rest, C3 through C6, all have that bifid split spinous process. C7 has a very large spinous process. And that's how we can tell the difference between some of these. But let's Look, C1 is known as the atlas. I had somebody once tell me that C1, that atlas, it's like holding the world on it. Like the world, like your brain, your skull. The atlas is what holds up your brain. That's what somebody told me one day, and it kind of stuck on, okay, that's C1 whenever I see it. So C1 really doesn't have it has no body whatsoever. Doesn't really have a spinous process. It is considered to have an anterior and posterior arch, as we can see here. This is what our C1 looks like. We have our posterior arch. And instead of a spinous process, it has a tubercle on it. We still have that transverse foramen, but we don't really have the transverse processes like the rest of them. We have this big, huge, superior articular facet. This is what holds our skull. Our entire skull sits on those. This is why somebody told me one day that this is like my atlas holding the world up. We have our anterior tubercle. We have that posterior tubercle. We have the anterior arch, just like we had the posterior arch. These are considered lateral masses instead of having a body. Here is the inferior view. So this is looking from underneath. We have a little facet here. This is where the dens of C2, we'll go into what that is when we hit C2, but this is where C2 articulates with C1. We have our inferior articular facets, which are still really big. These inferior articular facets here are what articulate with C2. You still get your transverse foramen on your transverse process, your posterior arch back here with that posterior tubercle. So let's look at C2. C2 is called axis. If you think about it, C2 lets you turn your head left and right and say no. C1, or the atlas, lets you say yes, move your head back and forth. C2 has a body, but it also has a knob-like piece that's called the dens. Some people say that the dens is the missing body of C1. So let's see here. We have those superior articular facets, just as big as what they look like on C1 on the underside. This is our dens, right here. You'll see it better when we look from the side. But the dens sits on the body of C2. You still get your pedicle, you still have your lamina. C2 has a spinous process. It kind of has a really small transverse process. But as you can see, here's the dens of the axis that comes up and it attaches and it articulates with that facet of the dens of C1. That allows us to turn our head left and right. And then we have the rest of the cervical vertebrae that all have the pretty similar features. Our thoracic vertebrae, they're a little different. We have 12 of them. They all articulate with ribs in one way or another. They have demifacets that articulate with the ribs. The body is more heart-shaped. They have kind of more of a heart-shaped body to it. That's important to know. Most thoracic vertebrae actually have two demifacets. For the on the top part of the body and on the bottom part of the body. So that counts as two demifacets. Then they also have a transverse costal facet on the transverse process. They also have those superior articular processes and those inferior articular processes. You see the inferior costal facet down here. You don't see the superior one. Well, let me come back to my chart. Here it is. So let's look at this thoracic vertebrae better. So it kind of has more of a heart-shaped body. We have our superior costal facets on the body. We have the transverse costal facets on the transverse process. They all have a vertebral foramen. They all have a spinous process, a transverse process, a body. They all have that same thing. Now let's look at the side view. Not only can you see the superior costal facet, but you see the inferior costal facet. You'll still see the transverse costal facets, superior articular process, inferior notch, spinous process. On the thoracic vertebrae, the spinous processes point more down. That is different than the cervical. The cervical point more out. So thoracic points more down. That's something that, besides the heart-shaped body, that is something else that makes them different. Let's look at the lumbar vertebrae while we're here. Lumbar vertebrae have the largest body. They're more kidney bean shaped here. They do not articulate with ribs, so they don't have any costal facets. But their transverse processes, they go straight out to the side. Like if you're holding your arms at a 90-degree angle out from your body, straight out to the side. The spinous process is also pointing more straight out, as you can see from the side view. The spinous process points more straight out than the thoracic. It's a lot shorter than the cervical ones too, but they still have all the same parts to them. So you learn it on one, all you have to do is be able to differentiate if it's cervical, thoracic, or lumbar. So here is the lumbar. As we said, there's 5 of them. There's 5 vertebrae here. They actually receive the most stress because they're carrying the weight of most of the body at that point, the upper part of the body. So the pedicles are thick, they're short, so are the lamina. That spinous process is kind of like a hatchet shaped. The vertebral foramen is triangular, and that body we said is kind of kidney shaped. So here's several of them. Those are thoracic vertebrae together. But as we looked at from the picture above, the spinous process kind of goes out straight back more compared to the rest of the body. We have our kind of kidney shaped body here that attaches. We have our transverse process that goes straight out to the side with our vertebral foramen in there. Our sacrum. Our sacrum, it comes below our lumbar vertebrae. Our sacrum is like a triangular shaped bone. It's technically 5 fused vertebrae. It's S1 to S5. They have a superior articular process. That's what articulates with L5, the last lumbar vertebrae. They have articular surfaces that actually form that sacroiliac joint. If you've ever heard of that, that's where the sacrum and the ilium bones or your hip bones attach. They form a joint there. There's the sacral promontory, which is the superior surface of that sacrum. We have transverse ridge because it was fused vertebrae. So you think of the transverse ridge was all transverse processes at one time. We have anterior sacral foramina where nerves come out. And then they kind of have a thing called wings or ala. We have, let's kind of look at our sacrum. Each of these transverse ridges was where vertebrae fused together. We have the medial sacral crest. These are where the spinous processes all kind of came together. We have that sacral promontory. We have our facets of the superior articular process that articulates with L5. We have our ala, which are like the wings or the transverse processes that all fuse together. We have the apex, which is the bottom. Below that is the coccyx. The coccyx is like 3 to 4 fused bones together at the bottom. We have our articular surface over here. This is what attaches to our hip bones, where our hips attach to the body. So let's quickly look at the ribs. Our thoracic cage is composed of the sternum, the thoracic vertebrae, and our ribs. They all make up the thoracic cage technically because it's all enclosed once it's all together. So it helps to protect your organs, your heart, your lungs. They're vital. We need them to live. They give a place for your shoulder girdle, so where your arms attach to the trunk. It also provides attachment sites for many muscles of the neck, the back, the chest, and the shoulders. It is all very important. So if we look at our picture here, these are all where we have our sternum here in the middle, right in the middle. Our ribs all along the side. We have what are called true ribs and false ribs. True ribs are ribs 1 through 7. Our true ribs are what come around and they actually attach straight to the sternum through this costal cartilage. Our false ribs are ribs that all come together. They do not attach directly to the sternum. They come to this cartilage area down at the bottom. And that is where they attach and they'll eventually go up and attach to the sternum. We have floating ribs, 11 and 12. They're not full ribs. They're just partial ribs. They don't attach to anything, but they still help to protect us. Our sternum, also known as the breastbone, is made up of 3 bones. We have our manubrium, which is the top part, that top bone, and it actually has clavicular notches because it articulates with the clavicle or your collarbones and the first 2 ribs. We have the body. That is what articulates with ribs 2 through 7. And then the last part is that xiphoid process. That's the point at the bottom. That doesn't ossify till 40. So our sternum has a jugular notch because we have our jugular veins that come out of the skull and take blood down to the heart. So those need to have a place to go. We have a sternal angle, which is kind of across the front of the sternum, and we have a xyphosternal joint. So here's that jugular notch right at the top of the sternum. We have our manubrium as the top bone. That sternal angle is where the manubrium and the body attach. The body of the sternum is the longer flat portion. Then that xiphoid process, as I said, is that little point at the bottom. So that xiphoid process, it already kind of points in a posterior direction in some people. So if you've ever had to give or see somebody get CPR, sometimes that xiphoid process breaks off. It can actually get pushed into the liver or the heart. Not good if there's some kind of chest trauma, but it can also break off completely during CPR, trying to resuscitate somebody. So as I've kind of mentioned with the ribs, we have our true ribs, which attach directly to the sternum. Our false ribs, which are 8 through 10, true ribs are 1 through 7, they attach by joining costal cartilage. Then our floating ribs or vertebral ribs, there's no sternal attachment. That's 11 and 12, as I pointed out in the picture above. So our ribs, just like every other bone in the body, has different parts to it. The shaft. That shaft is what makes up most of the rib. It's the flat curvature part that wraps around. There's a groove on the inside of the ribs that's where the nerve, it's called that costal groove, and it has the nerves, arteries, and veins that wrap around and follow each rib. The head is what articulates with the body of each vertebrae. The neck is just past the head. And then we have a tubercle, and that's what it actually articulates with the transverse costal facet on the transverse process of the thoracic vertebrae. So here's how it kind of looks. The head is what articulates with the inferior costal facet of demifacet of the superior vertebrae and the inferior costal facet of the lower vertebrae. We have the neck of the vertebrae, which is just past the head. We have the tubercle of the rib, which articulates with the transverse process, that transverse costal facet. We have the angle of the rib where that main curve comes. The shaft is the big long portion. Then it attaches through costal cartilage on ribs 1 through 7 to the sternum. So here's another view. As you can see, it is all held in place with ligaments. Ligaments hold your ribs in place. We have our head of the ribs, the neck of the ribs, the shaft that goes all the way around. So here it is on a real rib. Again, we have the head that articulates with the vertebral bodies. We have the neck of the ribs just past it. The articular facet on the tubercles. We have the angle of the ribs. That costal groove I told you about where the nerve, artery, and the vein go through. And then we have that junction where the costal cartilage attaches to the ribs that attaches the ribs to the sternum. That is actually everything here for the axial skeleton. We will continue with the next part in the appendicular skeleton and talk about our arms and our legs and what bones attach our arms to our legs. Have a wonderful day. Bye.